Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Jessica, and good afternoon, everyone. Today, I want to provide an update on COVID-19 in our province over the holidays. First, I want to thank the many Albertans who respected the measures in place and celebrated safely this Christmas. Your selfless actions not only kept you and your family safe, they also helped slow the spread of COVID-19 in your community and across our province. This is a wonderful gift to give others this holiday season. I was grateful to be able to have several Zoom calls with extended family, sharing memories, seeing the children's new toys, and even an impromptu piano recital and magic show by the kids. I hope that all Albertans found a way to connect with family and friends in a meaningful way over this holiday season. Today, while I am pleased to report that we have continued to see a decline in our active case numbers over the last 5 days, it is important to note that part of this decline has been due to less people presenting for testing, which is not surprising over the holidays. On December 23rd, 1,007 new cases of COVID-19 were identified and 15,585 tests were completed. 30 deaths were reported. On December 24th, 1,191 new cases of COVID-19 were identified and 17,845 tests were completed. 18 deaths were reported. On December 25th, 914 new cases were identified and 14,193 tests were completed. 17 deaths were reported. On December 26th, we identified 459 new cases and 6,866 tests were completed. 27 deaths were reported. And yesterday, 917 new cases were identified and the provincial lab completed 9,633 tests. 20 deaths were reported. Our positivity rate over the past few days has ranged from 6.4% to 9.6%. Unfortunately, the trend in those needing hospital and ICU care for COVID-19 has not yet come down. There are 878 people in hospital, including 148 who have been admitted to the ICU. My sympathies go out to those in hospital and to those who are supporting them, both their family and friends, as well as the healthcare workers who have been spending their holidays caring for them. In addition, my deepest condolences go out to the loved ones mourning the loss of those individuals who have passed away over the past 5 days, whether from COVID-19 or any other cause. The 112 total recorded deaths over the last 5 days brings Alberta's total for the COVID-19 pandemic to 1,002. Losing someone is never easy, but it is made even more difficult with the public health restrictions in place. I encourage anyone who is dealing with loss or grief to reach out for support from family, friends, or one of the many resources available at www.ahs.ca/help in tough times. There are safe ways to help you mourn, and you are not alone. We are not alone in this reality in Alberta either. Around the world and across our country, people are mourning the loss of their loved ones. The death rate in Quebec is 95 per 100,000. Ontario's is 30 per 100,000. Manitoba's 47, BC 16, and Alberta's is 20 per 100,000. Each of these numbers represents people whose loss leaves a hole behind in their families, communities, and groups of friends. Our actions to prevent spread prevent more losses like these. One such action is case notification and contact tracing. As I mentioned before the break, our contact tracers are continuing to work through the holidays and are reaching out to as many individuals as possible. I want to thank them and the Albertans who help them do their work by answering their questions and following their instructions. I also want to give particular thanks to Alberta Health Services for continuing to provide healthcare workers with their first shot of vaccine over the holidays. They have been administering shots every day except Christmas Day and will only pause again on New Year's Day. Their efforts have resulted in 6,016 doses of the Pfizer vaccine being administered in our province over the last 2 weeks, and the work will continue as more vaccine arrives and more vaccine gets distributed around the province. I want to take a moment to talk about what many have read about in the past few days, the variant of the virus that causes COVID-19 that prompted the federal government to stop flights from the UK a little over a week ago. In recent days, British Columbia and Ontario were first to report cases linked to recent travel to the UK that have this variant virus. In Alberta, we have now also identified a single case of COVID-19 caused by this variant in someone who had recently arrived from the UK. The good news is that this individual did everything they were supposed to do, following quarantine and other public health measures, and at this point there is no evidence that there has been any further spread. It is important to remember that the public health measures in place are protective against this variant, and the best thing we can do to protect each other is to follow them. Following public health measures is, in part, also contributing to our decline in cases. These encouraging early trends reflect our collective actions 1 to 2 weeks ago. We must remain attentive to the orders in place and continue to follow them closely to make sure that we don't see a spike in mid-January that ignites a dangerous spread in 2021. We must continue this work together so we can bring down the numbers of people needing hospital or ICU care for COVID-19. Seeing lower numbers is a good sign, but we cannot become complacent. Our healthcare system is still under significant pressure. Let's finish the year strong by following both the details and the spirit of the public health orders that are in place. Let's resist the urge to gather with anyone outside our household or to close contacts for those who live alone. Let's plan virtual New Year's Eve celebrations to ring in 2021. The new year holds a lot of promise, especially with the expanded rollout of vaccines in the coming weeks and months. Let's start it on the right path with lower case numbers and reduced spread. Finally, a reminder that my next in-person update will be on Tuesday, January 5th. We will provide online case reporting tomorrow and Wednesday, followed by a break from December 31st to January 3rd. Thank you, and I'm happy to take any questions.
All right, we will go to the phone now. Operator, please put through the first question.
Thank you. Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. The Ontario government is being criticized for cutting back on COVID-19 vaccinations over the holidays because of staff shortages. What approach is Alberta taking for vaccination during the holidays, and why?
As you've heard, the team at Alberta Health Services has made sure that they have staff allocated to provide vaccination over the holidays, including every day except for Christmas Day and New Year's Day. And they have done that by making sure that, again, they were planning for many months. When the vaccine arrived early, they were able to use those plans, those contingency plans, to move workers who typically would give, so public health nurses, occupational health nurses who are typically involved in these kinds of programs, to shift their duties so that they're able to move to being able to provide the COVID-19 vaccine to healthcare workers over the holidays.
Operator, can you please put through the next question?
Emma Greeny, Globe and Mail.
Yeah, g'day, Dr. Hinshaw. Hope you had a good Christmas. Quick question about the variant that was first spotted in the UK there. You said there's been one case here. What specifically are you looking for, if anything? Like, are you doing extra testing or anything like that? And then if we do see more cases with that variant, is there a level there at which you would up restrictions and kind of, I don't know, go go into more lockdowns or anything like that?
We are watching closely. Of course, across the country, we're having conversations with colleagues in all of the other provinces and territories to make sure that we each are informed about what we're seeing and that we're taking a collaborative and coordinated approach to this. What we know right now is there is some evidence that this variant may be more infectious than other strains of the virus. And as a precaution, we're therefore making sure that we're reducing the chance that we could get importation of many of these strains. One of the things that we have done, as you likely know, is we've recommended that anyone who has been in the UK, and as you likely know, there's been an identification of a different variant, but one that has a similar mutation in South Africa recently. And so we are recommending that anyone who has been in the UK or in South Africa in the last 14 days should get a test. And in fact, we've worked with the federal government to get a list of all of those who've been in those places. And Alberta Health Services will be calling all of those individuals to offer them a test. If they consent, then they'll be helped to book that test just to make sure that we're able to pick up if a variant does come in. We've also made sure that when people are coming in, that we are communicating to them if they otherwise would have wanted to participate in our border pilot. Unfortunately, that is not possible if they've been in the UK or in South Africa over the last 14 days. Again, because we want to take a cautious approach to this particular variant. So those are the kinds of things that we're doing right now to be cautious while we wait for more information to emerge about this variant. At the moment, we don't have any evidence that it's spreading widely in Alberta. And again, this particular single case, there's no evidence that it has spread at all in the province.
Operator, can you put through the next question, please?
Terry Reid, CBC.
Yes, hi, good afternoon, Dr. Hinshaw. Could you tell us what is happening with the Alternative Care Centre at the Butter Dome? When will it be open? When will it take patients? How will it be staffed? And whether other facilities such as the Saville Centre and the Olympic Oval are also now being set up?
Those detailed operational questions would be best for Alberta Health Services to answer, so we can follow up with AHS and get that information. Any of the backup plans that are being put in place in case they're needed would only be used if the number of patients needing care for COVID-19 was greater than the capacity of the hospital system to care for them. We have not reached that yet, and Alberta Health Services would have more detail, again, on next steps, timing, and planning for those.
Operator, can we get the next question, please?
Lauren Pullen, Global Calgary.
Hi, Dr. Hinshaw. Thanks so much for taking my question. Just a couple points here. I'm wondering if you have any update on the Moderna vaccine and when it will start being distributed here, any update on doses from Ottawa. And secondly, obviously, a very tragic and difficult update for you to give, 112 deaths, 112 people losing loved ones and families. Is this on par with what you were expecting, hospitalizations, ICU numbers, given the surge in cases we saw a few weeks ago, or is this above and beyond? And just a quick clarification point. On the federal government website, it says we have 21,521 active cases, but on our Alberta website, it says 15,487. So are you able to clear up where that discrepancy is?
Sure, thank you. So with respect to the Moderna vaccine, my understanding is that at some point this week we would be receiving it, but I don't yet have the specific numbers of doses. Again, I anticipate there will be more information coming soon on that. With respect to the deaths, ICU and hospital cases, absolutely this is a difficult update, and knowing that each one of those individuals is leaving behind family, friends, and co-workers, those in their community who will be mourning their loss. We know that it does take several weeks before the trend we're seeing in cases stabilizing and coming down, before we see that start to be reflected in our hospital and ICU numbers as well as our deaths. And we also know that some individuals are at higher risk of severe outcomes like death or for needing hospital care. So in some part, these numbers depend not just on the total numbers of who's infected, but also on which specific people are exposed and infected. And it's a reminder of why we all need to participate in bringing our numbers down so we can prevent these tragic outcomes. With respect to the discrepancy between the federal government website and ours, the discrepancy is likely because formal reporting was paused over the past 4 days, and so with the updates that will be sent on today, I expect that discrepancy will be resolved, but we'll definitely look into it and make sure that we're connecting and providing them with that accurate, updated information from today.
Operator, can you please put through the next question?
Janet French, CBC.
Hi there. Thanks for taking my question. I just wanted to know how much further along the selection committee is in determining who are the next priorities for receiving COVID vaccines. We've heard that some residents of private care homes and assisted living aren't in the first phase, and we've also heard from school employees who say they should be a priority. Who is in the next echelon or tranche of people who should be prioritized?
You're quite right that there are many people who are eager to be in that next sequencing of vaccine eligibility. And for that reason, of course, we do need to be very thoughtful about how we're approaching that. Final decisions will likely not be made for several weeks yet, as we do need to make sure that we are taking all those considerations into account. Our top priority is, of course, to prevent the most severe outcomes, which is why we're starting, as you know, with long-term care and designated supportive living facilities, where residents have experienced the most significant outbreaks and the highest rates of death. And as we're looking to see which are the groups that would be in the sequence for that phase 2 or stage 2 of vaccine, we're looking to the National Advisory Committee on Immunization for their framework. And we're also working with ethicists and our own teams of consultants. But again, it's going to take several weeks yet before we land on those final decisions, because we know there are many, many Albertans who can benefit from this vaccine. We want, of course, to be able to make it available to as many people as quickly as possible. But because it is a scarce resource, we do have to take into account all of those different elements to make sure that we're allocating it in an ethical way.
Operator, next question, please.
Bill Fortier, CTV.
Hi, Dr. Hinshaw. It's been just over 2 weeks now since some of those new restrictions were brought in, December 13th. This is a two-part question. The first part, do you suspect some of these lower numbers we're seeing in terms of new cases are a result of those new restrictions on Albertans? And if so, why do you think we're seeing these much higher numbers of deaths? Is it just a result of those high numbers we saw 2 weeks ago going into hospital and ICU, and now those people are dying, or is there something else at play here?
So there's a combination of things happening. The lower numbers that we've seen, especially the numbers over the past couple of days, are driven in part by less people seeking testing. So we know that over the holidays, fewer people will likely want to go to a testing center, or perhaps they may delay for a day or two, wait till the holidays are over. And so with lower numbers of people getting tested, of course, that translates into lower numbers of positive cases. We know that our positivity rate over this last 5-day period has been sitting typically between 6 and 7%. Unfortunately, yesterday we did see a jump to over 9% in our positivity rates. So that is somewhat concerning, but could just be a reflection of who is getting tested, and again, perhaps those who are those most highest risk who are going in for testing at this particular time. We also know that things like deaths, hospitalization, ICU, those are what we call lagging indicators, because they do happen at a delay of 1 to 2 weeks after we start to see our case numbers change. So we would expect that those numbers would take longer to start to come down than our case numbers. And you asked about the measures, the restrictions that went into place a couple of weeks ago. I do expect that that is a part of why we're seeing lower numbers, but it will be difficult to know exactly how all of these different pieces are contributing to our lower numbers until we start to see over this week whether our testing numbers go up, whether our hospitalization numbers start to go down. And ultimately, again, it really does depend on all of our actions together, and we are not, unfortunately, out of the woods yet.
Operator, can you please put through the next question?
Thank you. Emily Mertz, Global News.
Hi, thanks for taking my question. I'm just wondering about how your, or how I guess Alberta Health Services, I hope you can speak a little bit to this, is able to staff the ICU, the hospitalization, as we're seeing increasing numbers there, while also redeploying staff for vaccination.
The staff who are being deployed to deliver vaccines are staff who typically work in other areas, for example, in immunization of school-aged children, or some of the other, for example, the occupational health and safety teams are typically doing other tasks. So again, the people who are providing the immunization are not the same groups of healthcare workers who would typically be working in an ICU or in a COVID ward. And so that's part of the answer. Of course, the other piece of the work that Alberta Health Services is doing to make sure they are ready if we should need to care for increasing numbers of people with COVID-19 is that they are looking at some of the services that can be deferred or delayed, and they're redeploying healthcare workers from those services into areas where COVID-19 patients are being cared for. So the answer again is it's looking at all of the available healthcare workers, looking at the skill sets they have, and having them allocated to the work where they can provide that greatest benefit, which of course does unfortunately mean that in some cases other healthcare services are needing to be delayed or cancelled until such time as we can get our COVID numbers down again.
We have time for 3 more questions. Operator, can you please put through the next one?
Darcy Rothjam, City News.
Hi there, Dr. Hinshaw. I was wondering what you've heard around enforcement of COVID rules over the holidays, particularly around malls. There's more than a few social media posts showing packed malls here in Edmonton and elsewhere in the province for Boxing Day sales. Do you know if AHS or bylaw officers were out enforcing those limits over the holidays?
It's a good question. I don't have knowledge of enforcement over the holidays. I do know that we had several conversations with law enforcement and with Alberta Health Services before the holidays to make sure that roles and responsibilities were clarified and to set out the kinds of expectations that each group would be able to enforce. It's, of course, always disappointing to hear about times where there's crowded indoor spaces, because we know that that is a crowded indoor space is unfortunately an opportunity for COVID-19 to spread if people are in close proximity to one another. But I don't have any specific information around enforcement activities over the holidays.
Operator, please put through the next question.
Rob Drinkwater, Canadian Press.
Hi, Dr. Hinshaw. The variant of the COVID-19 that's arrived from the UK and is in Alberta, do you have any information on where in Alberta that person is? And what flight did the person come in on, the airport, that sort of thing? Are you doing any extra testing around people who might have come in on the same plane?
We are working with the Public Health Agency of Canada to be able to get the flight details and the list of individuals who were on the same plane. There's a time delay between when that individual arrived and when the symptoms began, and so it's something that's a theoretical possibility of transmission, so we are going to be following up specifically with individuals who were seated in close rows. But again, at the moment, we have looked at the situation and believe that the risk is very low, but we will be making those phone calls to make sure that we are providing that additional information to anyone who may have been seated near this individual on the flight.
And now we'll take the last question, please.
Alyssa Carpenter, CBC.
Hi, Dr. Hinshaw. I'm curious, I realize it's only a single case of the variant, but do we have any idea on the effectiveness of the current vaccine on a variant strain if it should spread?
Work is underway right now to determine whether or not the variant, again, there's a few different variants that have been identified, to identify whether or not the changes in the protein on the surface of the virus would change how effective the vaccine is. At the moment, the the information that I've received, that I've read, is that there's no current evidence that it's not going to be effective. However, of course, the different companies, Pfizer and Moderna, I understand, are doing some work to understand if there could be some impact on that. But at the moment, it does look like, again, there's no current evidence that the vaccine would be rendered less effective by this particular change in the virus's surface proteins.
Thank you all for joining us. Dr. Hinshaw will provide another update on January 5th, and there will be web updates tomorrow and Wednesday with a bit of a break until we come back with more web updates on January 4th. Thank you.